We begin this morning, though, with a big loss for the Biden administration in the Supreme Court and its efforts to enforce sweeping COVID vaccine mandates for large private companies.
It was a 6-3 ruling. The court, led by its conservative majority, wrote that OSHA, that's the Occupational Safety and Health Administration, did not have the power to regulate public health. In a statement, the Biden administration said it was disappointed by the ruling, arguing that if his administration had not put vaccination requirements in place, quote, we would be now experiencing a higher death toll from COVID-19 and even more hospitalizations. Here to help us break down the ruling and what it means moving forward, we've got NBC News legal analyst Danny Ceballos and Dr. Bob Lahita. He's a professor at the Hackensack Meridian Medical School and the director of autoimmune and rheumatic diseases at St. Joseph Health. He's also the author of Immunity Strong. Good morning to both of you. Danny, we'll start with you. The ruling comes just 3 days after the mandate went into effect. Talk to us about the reasoning behind the Supreme Court's decision and what impact it could have on any future legal challenges to vaccine mandates.
The court essentially concluded that OSHA overstepped its bounds. No surprise when you consider a justice like Gorsuch's history. This is something that Gorsuch has always been cautious of, is what he called the regulatory behemoth, the idea that the regulatory agencies of this country, who are not elected and who don't go through a democratic process in order to create law, simply create rules that govern the country. And so no surprise, if you've been following Gorsuch's career, that this is an opinion that would come from a court upon which he sits. Basically, the reasoning is that OSHA has a job to regulate workplace safety. COVID-19 affects people everywhere, irrespective of being at work, whether they're on the street, whether they're anywhere, whether they don't have a job at all. And so for that reason, OSHA overstepped its bounds when it went from just regulating safety measures at work to regulating public health generally. And for that reason, the mandate's put on hold. It's not struck down. It's not gone forever. That seems to be the Supreme Court's increasing role these days, is ruling on temporary restraining orders and injunctive relief, which really just hits a pause button until the issue is resolved at the court below.
So, Dr. Bob, I mean, we're dealing with a record surge in cases due to the Omicron variant right now. What are your thoughts on this ruling when it comes to public health? What might be the impact?
The impact is going to be great, Joe, because most hospitals, I would say virtually 99.9% of the hospitals in the country are taking Medicaid and Medicare funding. So they would be under this rule, and that all employees, that's all employees of any hospital, will have to be vaccinated protectively. Now, doctors' offices take Medicare and some take Medicaid, and clinics do too. And I don't know how the ruling is going to affect private physicians and their care of patients. That's interesting. Then the second point is police and fire do not take government funds unless they're in a specific category, and neither do EMS people. But some EMS programs do take Medicaid and Medicare funds for their transports, for example, critical care transport. So they're going to be under the gun as well.
Yeah, I want to talk more about what you're talking about there. It was a separate 5-4 decision from the Supreme Court. They did allow a similar vaccine mandate to stand for medical facilities that take Medicare or Medicaid payments. So, Danny, I'll ask you, talk to us about the reasoning behind the court's split decision on both of these mandates, why they were okay with one but not the other.
The power of the spending power. It's nothing like the Commerce Clause power, but quietly the federal government can regulate what a lot of people do in the states using the power of the purse. And this is no exception. The court is essentially saying that facilities that accept money from the federal government in the form of Medicare or Medicaid do have to comply with vaccine mandates. And that, of course, is a separate issue than simply OSHA broadly saying that thou shalt have either testing or be vaccinated. It's a separate analysis, but basically the court is saying that as long as these facilities are willing to accept the money, then they have to comply with the rules that come along with that money. So not a big surprise there. The court, at least in the last decade or so, has been increasingly accepting of the spending power and actually giving it a pretty broad interpretation.
So, Dr. Bob, let's talk more about that decision. It's going to cover 17 million healthcare workers in 76,000 medical facilities. We know, you know better than any of us, the medical field has been dealing with a shortage in healthcare workers. Do you think this ruling has any impact on that shortage? Are we at the point now where most healthcare workers are vaccinated? What do you think could be the impact of this?
It depends on the institution, Joe. We have mandated the flu vaccine, for example, for many, many years. But right now, this is going to result in a lot of healthcare workers, doctors and nurses resigning or being terminated from their positions. Not so much a big problem in the Northeast, where these mandates have been in place for many years, but in other parts of the country, rural hospitals, for example, and in those states which are not really highly vaccinated, this could have a major impact on staffing.
Yep, good point. That's exactly where we could see the biggest impact of this. All right, Danny Ceballos, Dr. Bob Lahita, thanks so much for helping us break down these big court decisions.
Now, the White House has announced new points of focus as they try to lead the charge on controlling the spread of the very contagious Omicron variant. The U.S. recorded another million COVID cases in the past day, bringing the total now to 64 million cases since the pandemic began. Health experts are now telling us to upgrade our masks, and President Biden says there's a plan to make more high-quality masks like those N95s we're talking about again available for free. This comes as hospitals are overwhelmed, especially in the 6 states you'll see on a map here. Federal medical teams are now on their way to hospitals there, giving healthcare workers some much-needed relief. There's that map. Now, yesterday, the president addressed the frustration a lot of Americans are feeling right now about the pandemic.
You know, we're all frustrated as we enter this new year. Omicron variant is causing millions of cases and record hospitalizations. But as long as we have tens of millions of people who will not get vaccinated, we're going to have full hospitals and needless deaths.
NBC News correspondent Antonia Hilton is joining us from one of the hospitals who's going to get federal help. That's in Coney Island Hospital in Brooklyn, New York. And NBC News correspondent Josh Letterman is following these latest developments out of the White House on its response. Good morning to both of you. Antonia, I'll begin with you. So first, just tell us what kind of help is on the way to the hospital where you're at.
Good morning, Savannah. So I'm here at Coney Island Hospital, and they are one of these 6 hospitals in various states that is receiving one of these military medical surge teams starting on Monday of next week. And what it's going to look like is teams of 20 or more people coming in and essentially joining the hospital staff here. It's going to include physicians, nurses, technicians, clinicians who are going to jump in right into the everyday operations to help hospitals like this one really survive the next 30 days or months. They're going to be on the ground for about a month-long period. And the idea here, right, is that because of the surge in cases, but also really critically, the overwhelming of the operations here at hospitals like Coney Island Hospital, where there have been staff members who have taken early retirement, people reporting extreme burnout, and then also staff members catching Omicron themselves and not able to come to work and actually do critical life-saving services here. The idea is that these folks from the military surge team are going to come in and help float the hospital through these next critical 4 weeks or so. Savannah?
Now, Josh, let's talk about some of the federal response here. This is just the latest form of federal help. Hospitals are getting these boots on the ground. But what else has the government done to help hospitals in this surge, and what else could be coming?
Yeah, Savannah, these teams are part of a joint military operation that the Pentagon has actually had up and running since August. And the numbers have ebbed and flowed. They're U.S. Air Force, Army, as well as Navy forces. Right now, it's about 630 or so. But in December, President Biden announced another 1,000 troops would be going to hospitals in need as they anticipated this crisis we're facing right now with Omicron. So these teams at the hospitals, including the one where Antonia is at right now, are the first batch as part of that surge of forces. We'll see more teams deployed in the coming weeks. The Biden administration, through the massive COVID spending bills that were passed last year, has also provided hundreds of billions of dollars in aid to hospitals that are in crisis right now. But President Biden says the real issue here is not the money, but the unvaccinated. Take a look.
Unfortunately, while our military is stepping up, as they always do, there are others sitting on the sidelines, and we're standing in the way. If you haven't gotten vaccinated, do it. Personal choice impacts us all, our hospitals, our countries.
But the reality is, Savannah, President Biden keeps beating this drum of we need to get the unvaccinated to get that shot, but he just lost one of his most important tools to do that in that mandate the Supreme Court put away, as Joe was just discussing.
Yeah, absolutely. Now, Antonia, where you are in New York, that's, of course, not the only area where hospitals are feeling the strain. It's happening across the country, including in our neighboring New Jersey. A hospital there is also going to get federal medical team to them. How do they plan on using that team?
That's right, and that is University Hospital in Newark. And what they say is that they expect this surge team to come in and become a seamless part of their operation. So if you're a patient or person visiting the hospital, the idea is you almost wouldn't notice that they're there because they're filling already critical positions. You know, again, these are physicians and nurses and clinicians, real healthcare workers with the skills to triage patients, to run everyday hospital functioning. And that's what they really need. I mean, the CEO of the hospital has described them as bursting at the seams. And so this is really critical care. And the idea is that you're going to see them looking like the same nurses and doctors who are supposed to be there every day in and out, but who right now are in many cases sick themselves and unable to support critical functions. Take a listen to Dr. Sharif El-Nahal. He's the president and CEO of University Hospital, and he talks a bit about the meaning of this help they're about to receive.
It's all hands on deck. We're going to be deploying them strategically where we're hurting the most. So the emergency room, for example, making sure that we're staffed up in our intensive care units, and really whatever the skills that these folks come with. A lot of hospitals are in a similar position to us. We serve a very vulnerable community here. We are bursting at the seams. And again, could not be more grateful for this.
And what's critical to know, too, is, right, this is Newark. I'm here in Brooklyn, and these are hospitals that are serving, you know, really diverse communities that have been hit the hardest by COVID, often seen some of the most challenging outcomes. And so the support they're about to receive from the federal government, they are saying that they're incredibly grateful because it's not just about their hospital functioning, but it's also about helping and surging resources to the most needy communities. Savannah.
Yeah, Josh, let's talk about a couple more of those resources, which are those high-quality masks, as well as tests that Americans can request online. There was really some vagueness around this for a while, but we do have a better idea of when that will be available. What did the president say?
Well, at least we know now, Savannah, that the president has a plan or is going to have a plan to get free N95 high-quality masks to Americans who need them. We don't know exactly what that plan is, other than that President Biden says we'll know more about it next week. Ostensibly, it would look something like the program that they are also in the middle of putting together to distribute free COVID-19 home test kits to Americans who request it through a website. We know that according to the White House, by the end of next week, they expect to have taken delivery of that first batch of 500 million tests that President Biden has ordered. Yesterday, he announced another 500 million are also in the works, and we expect that by the end of the month, the first of those COVID-19 home tests will be in the mail to Americans.
All right, Josh and Antonia, thank you so much for your coverage this morning. Now, as you have noticed, we cover a lot of COVID news every day. We talk to a lot of doctors, and we know you have questions about the pandemic, whether it's about this variant, vaccines, or masks. Maybe you're still thinking about getting your first dose. We have doctors on our show ready to answer your questions. So email us. You can see it there on the screen, morningnewsnow@nbcuni.com with your questions. And thank you to those of us who have already done so. We love getting answers for you. You can also let us know if you want to stay anonymous when you're asking that question.
We're following major new developments in the January 6th investigation. Federal prosecutors filed new charges against key members of one of the groups accused of playing a central role in the insurrection.
Yeah, investigators now say more violence was planned even after the attack. NBC News Justice correspondent Pete Williams has more.
It's the most high-profile charge yet, stemming from the Capitol riot. Stuart Rhodes of Texas, the leader of the far-right Oath Keepers, is in federal custody, accused of conspiring with 10 other members of the group to carry out acts of violence to stop Congress from formally counting the Electoral College vote for president. They're charged with the crime of seditious conspiracy.
While all conspiracies are serious, a seditious conspiracy, an unusual federal charge, not often brought, is even more serious.
As early as 2 days after the election, prosecutors say Rhodes reached out to his group's leadership team with this encrypted message: "We aren't getting through this without a civil war." In late December, court documents say he messaged the team, "We need to make those senators very uncomfortable with all of us being a few hundred feet away." The day before the riot, the FBI says one of the Oath Keepers drove around the U.S. Capitol on a reconnaissance mission. On January 6th, the government says as rioters began breaking through police lines, Rhodes messaged his leadership saying the nation's founders stormed the governor's mansion in Massachusetts. A short time later, Oath Keepers began working their way into the Capitol in two groups lined up in military-style formation. Stewart Rhodes remained outside the building, but in the hours after the riot, the government says he met with his team to plan further violence. In the following weeks, prosecutors say he spent more than $17,000 buying weapons and ammunition. And on Inauguration Day, they say Rhodes messaged, "After this, if nothing happens, it's war, Civil War 2.0. His lawyer says the evidence doesn't support the charge. Last year, Rhodes himself said members of his group went off mission by entering the Capitol, but that he never instructed them to do so.
All right, Pete, thanks so much. And now, while the FBI arrested the leader of the Oath Keepers yesterday, as you just saw, the House committee investigating the attack moved forward with their work as well.
The committee issued subpoenas to Twitter, Reddit, and the parent companies of Facebook and Google. The House panel wants those companies to provide more details on how their platforms spread misinformation in the days and weeks leading up to January 6th. NBC News Capitol Hill correspondent Leanne Caldwell joins us now. Leanne, good morning to you. So walk us through the details of these subpoenas. What exactly does the committee hope to learn? Are they focused on what the companies did do, what they didn't do?
All of the above, Joe. So this is a follow-up from an August 26th letter that the committee sent to these four companies, and actually more companies as well, asking for some of this information. Now, the committee says that after 4 months of negotiations with these four committees, they are unsatisfied. And so they are sending these subpoenas. And each company, what they want from it is a little bit different. From Reddit, for example, this is where the subreddit The Donald was, and where there was a lot of violent conspiracy theories on that subreddit. They want to know what YouTube did and what their algorithms are, as some of the people involved in January 6th used YouTube. But one thing that is underlining throughout all of these subpoena requests is that all four of these social media companies were readily used by people who were involved in January 6th or perhaps even planning January 6th. Joe, Savannah.
Leanne, let's now turn to something else that's brewing on the Hill. So this ongoing battle between the White House and Senators Sinema and Manchin over the voting rights legislation. So we now know both senators reiterated their opposition to killing the filibuster yesterday, something we've now heard President Biden say he would do. And this is even after President Biden took a trip to Capitol Hill. So what happens now? I mean, what do Senate Democrats plan on doing now to keep this legislation alive, given there's still this issue within their own party?
Yeah, well, they had a deadline of Martin Luther King Jr. Day to accomplish this. And there's been another thing that has been thrown at them. One of their members, Senator Brian Schatz, has gotten COVID. And so they don't even have 50 votes to even address this situation. So everything has been put off until next week. But even so, there is basically zero chance that they're going to be able to pass this legislation because they're not going to be able to pass these rules changes. This is what President Biden said leaving that closed-door meeting with Senate Democrats yesterday.
I hope we can get this done. The honest-to-God answer is I don't know whether we can get this done. As long as I have a breath in me, as long as I'm in the White House, as long as I'm engaged at all, I'm going to be fighting to change the way these legislatures have moved.
The reason is, of course, because Senators Sinema and Manchin came out saying that they would not support any rules changes that would enable the passage of voting rights legislation. Those two senators met with President Biden again last night. Very blunt and very short readout from that meeting, saying they just had a respectful discussion. Sounds like zero minds were changed. Savannah, Joe.
And Leanne, looking way ahead, we learned yesterday the Republican National Committee is considering withdrawing its candidates from taking part in presidential debates in the 2024 election. Quickly, what could this mean for presidential campaigns?
We don't know yet. Now, this is just a threat. Negotiations are ongoing, but there's been one person who has been critical of the Committee on Presidential Debates. That is former President Donald Trump, so this could be an effort to appease him. They say that the commission is rigged and partisan. So we'll see where these negotiations go. But this has been an institution running these debates for 3 decades.
All right, Leanne Caldwell, thanks so much.
Yep.
Let's get a check on your morning news now. Weather.
Meteorologist Bill Cairns joins us now with the latest on that major winter storm expected to impact millions, sweep all over the country. Hey, Bill, good morning.
Yeah, it's going to be a busy 4 days. Good morning to you guys. Snow is already falling this morning. We got school delays in some areas, some cancellations, and we're pushing this storm from the plains today all the way through Martin Luther King Jr. Day on Monday into the Northeast. So we got quite a journey to go on here. So the snow this morning already breaking out in Minneapolis. Des Moines, the snow is starting along with Ames. So you got the idea of where the storm is going to hit. It's a narrow band through the northern plains. That pinkish, peachish color there, that's a winter storm warnings. That's where you're going to have the highest impacts from Fargo to Des Moines. And then everywhere in blue is under a winter storm watch. That's where we're still waiting to iron out the details exactly of what you're going to deal with. But for my friends in the Carolinas, ice is a big concern, mostly just going to be a snow issue from Memphis to Nashville, Pittsburgh, Buffalo, Charleston, and in western portions of New York. So let's play this out. By the time we get through this evening, snowing pretty good in areas of southern Minnesota and in Iowa. We'll go from rain to snow tonight in Kansas City, St. Louis. And then tomorrow we'll watch rain to snow in areas like Little Rock. It's going to take a while, but we will get some snow in the backside after a rainy day in Memphis. Same for you in Nashville. As you wake up Sunday morning, you'll get some snow to deal with. Then Sunday, this is when the storm really blows up. It gets much bigger, heavy snow, a lot of travel issues in the Appalachians. Interstate 81, by far, it will be a very dangerous ride if you're going to try to do that. Probably advise not to as you go into Sunday. You notice the storm tracks along the coast, so that's mostly a rain event from D.C., Baltimore, Philly, New York, Providence up to Boston. Interior sections get the most snow. So as far as snow totals go, the blue is around 3 to 6 inches. Once you get to the purple, that's 9 inches. So a pretty good snowstorm there for Iowa today. Lesser amounts, Kansas City, St. Louis. And then the areas in the east, it's the Appalachians, West Virginia, Western Pennsylvania, Western New York, who really gets the higher totals. It's a quick burst of snow over to rain in areas, especially from D.C. to Boston. And I mentioned that ice, guys. If we're going to have any big problems that linger into the work week next week, it would be from power outages in the Carolinas. We are concerned, especially from Charlotte to Raleigh, Winston-Salem, Greensboro. Those are the areas we're most concerned with.
All right, we know you'll keep an eye on it. Bill, lots to cover. Thanks so much.
Yes, thank you, Bill.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.